South Carolina, Orangeburg. This is Harvey Elwood, New Perspectives, 90.3 FM, WSSB, broadcasting right here from South Carolina State University. Tonight we're going to talk about a subject that I hold particularly important to me, and I know it's also important to many of you all. We're talking about our health. We live, we're born, and we live, and then, of course, we expire. But the quality of our life is so important, and how we treat ourselves will make a measure of how well we live our lives. And to that, and with that in mind, I've requested and asked and was most graciously received the reply from Dr. George Castro, who is a guest on New Perspectives this evening. Dr. Castro, welcome to New Perspectives.
Thank you. Thank you.
Dr. Castro is a cardiologist, someone who works with the human heart, cardiovascular system, the veins and the arteries and all that good stuff. And he's going to talk with us tonight about his practice here in Orangeburg. He's located up on Cook Road, right near the hospital, Orangeburg Calhoun Medical Center. And he's going to tell us about heart situations. And as most of you know, I'm a young man who's had some heart situations and have inherited it and have other family members. And I'm sure many of you out there either have had some heart-related concerns or have had family members likewise who have had some heart-related concerns. Dr. Castro, welcome to New Perspectives again.
Well, I think the most important reason why I came, I think that it's important for not only in Orangeburg but in South Carolina to realize that the number one killer, not only in the country but in the state, is heart disease.
Wow.
We used to think many years ago that heart disease was primarily a male-dominated illness. It turns out that more women die from heart disease than all the cancers put together.
Wow.
And that is something that needs to go out, because as we begin to see more and more women, they have to realize that, yes, you have to check yourself for all kinds of different cancers, but realize that the number one killer, again, and I'm repeating that just to make the point, the number one killer of women in this country is heart disease.
Heart disease.
And when you looked at South Carolina, particularly Orangeburg, the risk factors that would make women more at risk is diabetes and hypertension, and also risk of vascular diseases such as strokes. So when you look at our particular population, they run a higher risk, actually, if they have diabetes. Nowadays, if you're a diabetic, you have heart disease until proven otherwise. So it's no longer a risk factor.
Sure.
It's actually, if you are a female or a male and you have diabetes, you have heart disease, even though you may have no symptoms.
Symptoms, yes.
So that's important, because as we begin to give that information out, maybe we get to evaluate patients quicker and earlier before they had heart disease.
Yes.
Or before they have the heart attack.
Yes.
And the reason for that also is that in spite of all the new techniques that we have of stenting and open heart,
yes,
more than half of the patients die of sudden death.
Yes.
Before they reach the hospital.
Just recently, we here at campus, unfortunately, have had someone to expire from cardiovascular disease, heart attack, sudden heart attack. And you said diabetes. Now, what's the correlation there? Why is this something that we didn't know about, or is it brand new?
When you look at all the risk factors,
okay,
the process of atherosclerosis is the buildup of plaques of cholesterol throughout your vascular system.
Yes.
In the cerebral arteries, in the kidneys to give you renal failure, in the legs to give you peripheral vascular disease, in the heart, it's the same coronary arteries that will give you a heart attack. So we're dealing with a diffuse process of atherosclerosis, which is accelerated.
Okay.
If you have diabetes,
sure.
If you have hypertension,
right.
If you smoke,
right.
If you don't do exercise, if you have high cholesterol levels. So when you look at all those risk factors, even though you may not have any symptoms, I think it's important that you begin to seek some form of testing that we have available to try to find patients before they have sudden death, before the big heart attack. We could help them afterwards, but if we could try to get them to us before they have a major event. So I think it's important that the more risk factors you have, that even though you may not have any symptoms, that you talk to your physician and maybe do some tests that will find this occult disease before it strikes.
Are we talking about older people, middle-aged people, young? Is there an age-defining number?
It used to be an age-defining. We used to think that in men it will be over the age of 55, and in women over the age of after 65. It happens that in women, the risk of heart disease increases after menopause.
Okay.
But we now are realizing that the age factor is much younger.
Okay.
So it's not unusual to see a 45-year-old with heart disease, especially if they've been smoking for 20 years. So if you started smoking at 15, 20 years later, you may have a significant risk for heart disease because it's not your age, it's how long you've been exposed to the risk factor. So we're seeing younger and younger patients with heart disease. So it's no longer that 55, 65, but we've seen them in their late 30s and early 40s.
Wow. What is diet also? I heard you talk about other risk factors. Stress, I know stress is a factor. Diabetes, I know you said diabetes. Also, we talked about smoking just now. You just mentioned smoking and how bad that can be. What about diet?
I think diet is very important, but I think more than diet is actually, when I hear the word diet, I don't like the word diet.
Okay.
Because what I like to see is people eat healthy.
Okay.
A lot of people concentrate too much in losing weight and going into diets that actually put them at risk for heart disease.
Okay. How is that? Explain that, Doc.
Because I think you could get into a diet that you could lose weight, but still your cholesterol levels are still high.
Okay.
So the best thing to do is to involve yourself into a healthy diet with a low fat and concentrate more on that. But you also have to have your levels of cholesterol checked, because there's also a genetic predisposition to hypercholesteremia. So you could be doing everything right. You could be very thin. You could be healthy.
Right.
And you could still have high cholesterol in spite of a great diet. So even if you're dieting and even though you think you're doing the right thing, you still need to check your cholesterol levels.
Okay. Is that just a regular? How often should someone get their cholesterol checked?
I think, depending on your risk factors, but I think if you're a male in this country after the age of 55, you should once a year. If you're a female after the age of 65, however, the more risk factors you have, if you're a smoker, if you're overweight, if you have a strong family history of heart disease,
yes.
then you may need to look at checking your cholesterol levels much earlier than that.
Okay.
And I think most family doctors will guide you in the right way as to at what point is the best time to get your cholesterol levels. But we're actually, the process of the disease of atherosclerosis has been seen in patients as early as their teens. During the Vietnam War, and I hate to say it this way, but in a lot of the autopsies of soldiers that had died, that were 19-year-old, they already had atherosclerosis in their arteries at the age of 19.
Arteriosclerosis is the hardening of the arteries?
Is the buildup of cholesterol of plaques that eventually build up to a point where they will obstruct that artery, whether it's in the brain, whether it's in the heart, or the kidneys.
Okay. So that's grease,
Just
fats, I see. Exercise. Everybody talks about exercise. They talk about what we can do in terms of exercise to increase the level of our heart or the condition of our heart. What do you know?
Now, exercise have been documented. They've done some great studies recently to actually prove that exercise increases the level of HDL. HDL is that part of the cholesterol system that takes away cholesterol from the artery.
Okay.
And that's increased by exercise.
Okay.
So one of the things that has been documented, that if you have low HDLs, exercise as a component of diet and everything else will increase that part of your lipoprotein that will take away cholesterol from the arteries. So exercise is one of the major components of a healthy life, but also of preventing or regressing the atherosclerotic process.
I understand. Because in actuality, I realized that it was so important for me to get some kind of exercise. Just recently, I've enrolled with the coronary rehabilitation connected with the hospital, and I believe it's going to do me a lot of good. They monitor you, they check your blood pressure, and they will make sure that you are prepared to be on those machines, and I think it's going to do me a lot of good. I want to say that I don't think that, based on my experience with you, that heart disease is not a life sentence, that a person can somehow do things to improve their health if they listen to the good advice of their cardiologists, their doctors, and alter their diet, their lifestyles, and whatever it is that got them into trouble in the first place. There are some people that I know who smoke cigarettes for many years, as you said. I'm not going to talk about my own situation, but I can say, thank God that that's not something I have to deal with anymore. I mean, it has been difficult for people. That is what brings on, these healthy hearts.
The point you bring is in fact, I've seen patients that after a heart attack, it's a wake-up call. They stop smoking, they begin to exercise, they watch their diet. Well, guess what? He's probably going to live longer than the guy who didn't have a heart attack, who continues to do the wrong things. So it is absolutely not a death sentence. If you do the right things, if you take your medication, if you exercise and you watch your diet, the prognosis of someone who's had a previous heart attack is actually related to how well they follow this
doctor's advice
and take care of themselves.
I'll tell you, I want to be honest with you. I want to I personally, of course, I thank you. Ladies and gentlemen, New Perspectives, of course, we're talking about health-related situations here, and we're talking about the heart. We're talking about the importance of it. And as a person who suffered from coronary problems and heart condition, I can say that you don't have to call this a life sentence. First of all, listen to the advice of your cardiologist. And learn. What about learning? I mean, do you advise a person who comes to see you to read up and study about the medicines that they're taking and become more? In other words, the question I'm asking is, does a person do better who's being seen by a cardiologist or any doctor for that matter? Do they improve their chances for improvement by what they study about their own conditions?
I think it's very important in today's
society,
computerized society, that you could get on the web and just print heart disease. And there's so much information that is actually prepared for the lay person.
Sure.
So it's put in a format that is easy for someone who is not a cardiologist to be able to read and understand the process, understand the dieting. So yes, actually, there's so many websites for the lay person who has got heart disease, who wants to learn about heart disease.
Dr. Castro, I want to ask you another question. And as a matter of fact, it's related to what we just talked about. One of my medicines is potassium. I have to take potassium. And believe it or not, it was only until yesterday or the day before yesterday that I decided to go on the internet to find out, well, why am I taking the potassium? The Coreg I understand. The Lipridacil I understand. The medicine to control my sugar I understand. But the potassium, I know that if I didn't have it, it would make me cramp. But something made me go on the internet to read up on it. And now I understand a little better. Maybe you want to tell people what potassium does for the heart.
Well, potassium is one of those electrolytes that is very important. In fact, it's not only a cramp. If your potassium drops below a certain level, you will have cardiac standstill. Your heart will stop at a level of potassium less than 2. Now, potassium is regulated by your body very easily.
Okay.
You eat potassium. If you eat too much potassium, your kidneys will get rid of it.
Right.
However, there are medications that would increase the level of potassium, so we have to monitor that. Diuretics that are used in people with heart failure.
Yes.
As you diurese,
take off the water. Right.
Potassium comes out too, so you have to replenish the potassium.
I understand.
It's one of those things that happen as a consequence of some of the medications.
Okay.
So unless you have renal failure.
Sure.
But in people with heart disease, sometimes the medications can increase or lower your potassium. Either one of them can be catastrophic if it's not monitored.
Okay. We have a large amount of heart disease, and we talked about a lot of different ways. People who just inherit these situations, in other words, they live good, they eat healthy, they do all the right things, but yet and still they still contract or they have some problems with their heart. How do we find out about these people? Because heart attacks, as some people have often put it, is a silent killer. And how do we find out about? What do you recommend?
I think that following the advice of your family physician, I think family physicians now are becoming more and more aware that heart disease is so rampant that even though you may not have any symptoms, if you have certain risk factors, there's certain kind of tests that we could do to find out whether you have a potential blockage in an artery that could in the near future cause you a sudden death or a heart attack, such as a stress test. So some of the tests that we have available that are very good in trying to...
Ultrasound kind of tests?
Yeah. The ultrasound is mostly to see if there's any damage on the heart.
Okay.
But the stress test, it's a nuclear stress test, actually. We have different kind of tests that we could do to find out if there is a plaque of cholesterol, and if that plaque is within the near future, more than likely to give you a heart attack. So screening tests such as a stress test, nuclear stress testing, ultrasounds of the heart.
Okay.
There's all kinds of tests that we could do that are very predictive of somebody developing blockages. We also could do cardiac catheterization.
Okay. And what is that process? What is that done?
It's basically where we put a little catheter in the femoral artery. It's an invasive test. That little catheter goes into the heart.
Nothing to be scared of, right?
No, not at all.
Right.
We inject dye, and we could take x-rays of the arteries, and we could measure that there's blockages there, how severe they are, and better predict what kind of other, if you need surgery, open heart surgery, if you need stenting.
And the stent is the
stent is like a little scaffold. You go into the artery, and with a little balloon, you actually press the cholesterol against the wall. You don't get rid of it, but you it's like stepping on snow.
Okay.
You open up that artery.
Push it down. Yeah.
And then you put a little scaffold there to prevent that from rebounding.
Gotcha.
And basically, you could go from a blockage of 90% to 0.
Gotcha.
And go home the next day.
Sure.
We also have open heart surgery in those patients that have multivessel blockages.
Yeah, I've heard of people having 4 and 5 different areas of the arteries that are blocked. Whether it's triple bypass, quadruple bypass. How do people get to that point when they got so many different is that just...
Well, it's a combination of everything.
Yes.
It's a combination of family disease.
Poor genes, okay.
Poor genes,
bad diet,
bad diet, diabetes, hypertension,
smoking,
obesity.
Yes.
Obesity is rampant in our society, even in children.
And young people,
What we're seeing is as children have more obesity, well, guess what? Cardiac disease is going to be seen at a much earlier age, which is what we're beginning to see now.
Understood.
So there's also all kinds of tests that can be done that will be predictive of near future events.
I've been hearing some things about them doing some DNA studies where they're actually tracing what's going on with the parents and the grandparents. And they're saying that there are some people that may have a predestination of heart disease, and they're going to be mapping out or looking for, and I know they're doing it with diabetes and a lot of other things. One question that I do have for you, there are some people who didn't have diabetes, but then they had a heart problem, and then all of a sudden they began to get elevated blood sugar levels as a diabetic. What causes that? Is that normal?
That's basically genetics.
That's genetics.
That's the gene turning on.
Right.
I think what we've been finding more and more that we all have the predisposition of certain genes, that there is a gate on that gene. We're born with that gene, such as women with breast cancer.
Yes.
It turns out that there is a gene,
a history,
that it may turn on or it may not. Same thing with the heart disease.
Sure.
So there's a subgroup of patients that don't have high cholesterol.
Right.
They're not obese, they don't have risk factors, and they still develop blockages in the arteries.
Yeah.
Now, those are genetic predisposition. That's a small group.
Sure.
But the major group, 90%, is all risk factors that can be controlled, that can be treated, that can be prevented.
Well, Dr. Castro, I'm not going to hold you. I know you got to go. I know you're busy. Tell us, first of all, where are you again? Where's your location?
I'm at 1137 Cook Road, but my main thing is to come and talk about heart disease. The one great thing about Orangeburg is that we actually have 5 cardiologists, 5 greatly trained cardiologists, my colleagues.
All right.
And it's not only me, but we have a lot of good cardiologists. I know
Dr. Christian as well.
Yes, we have Dr. Christian, Dr. Wells, Dr. King, Dr. Huddle. Excellent cardiologists. Okay. All of us are available, and we need to be used.
Because I know that when you're in the hospital here in Orangeburg, if you're checked in with a heart-related situation, you or one of the other 3 that you mentioned, or 4 that you mentioned, will visit, as well as you have an excellent, and I have to say this because if I don't say this, he'll probably hang me, but your physician assistant, Chris.
Chris, yes.
And he is fantastic.
Thank you.
I mean, I just had the superintendent of schools. She was just here a moment ago telling us about how important it is to have good staff. And I want to thank you, Dr. Castro, for coming to New Perspectives, talking about heart disease, talking about the problems that, and perhaps we'll invite you back or get Chris on. Chris's last name, Chris
Smith.
Smith, that's right.
We call him the Chris.
Yeah, the Chris. And he's a great young man. He saw me in the hospital. And one thing, ladies and gentlemen, is so important. Be honest with your doctor. If you've had some condition or situation in your life, discuss it with them. You know, tell them honestly what has gone on in your world. Speak with them about what has happened in your life. And they can begin to start helping you to turn it around. You know, and that's exactly what Dr. Castro and Chris Smith and his office have done for me. And, of course, as he mentioned, Dr. Hutto, Dr. Christian, who treats my uncle, who's from North, Mr. R.J. Harley, and our family, we just love and you treat my sister. You treat my sister Martha, and she's doing well. And it's also, that's another thing, that family support, Dr. Castro, how does that play a part in?
That plays a major role, and I see that in my office every day. You know, here comes either the wife or the husband with a heart problem, and he's smoking and he's trying to stop. Well, she needs to stop, or he needs to stop. Yeah. If he's going to get in a diet, you need to help him with the diet.
Sure.
Let's all get and start exercising.
Sure.
Let's make it a family problem, not just the person who had the heart disease, because eventually the partner will get it.
Sure.
So I think it's very important to have a family support.
Yeah.
It's like if I try to go into a diet and I come home and somebody's cooking, well, I'm going to eat.
That's right. Sure.
So if somebody has heart disease, I think the family put together and try to
a better
eat
meal.
healthy together.
Better meal,
because that's good for your children.
Sure.
Too.
And if you're going out to exercise, it would be nice for somebody in the family, even if it's just walking, because I hear walking is a good exercise.
And one of the things that everybody has to, I hear this all the time. Well, I need to join the gym, but I don't have time. Forget all of that.
Sure.
All you need is aerobic exercise. If you do 20 to 30 minutes 3 times a day of a brisk walk, that will prevent more heart disease than everything else put together.
Okay.
So, gym is great, the treadmill is great.
Just walking is good.
But if you don't have time, just go out there and have a nice brisk walk with your wife or your partner or your kids for 20 minutes 3 times a week.
Sure.
And that will make a significant impact in heart disease.
Sure. Well, Dr. Castro, I'm not going to hold you. We're gonna cut this show a little short tonight, only because we'll make it up some other way. We'll get in another guest. Okay. But I do want to thank you, man.
You're very welcome.
I thank you for the service that you provided to this community. And again, ladies and gentlemen, New Perspectives, 90.3 FM, WSSB. We've been proud, and as with the greatest amount of humility that I've had Dr. Castro here from the cardiac. Your name of your office is the
Carolina Heart Center.
Carolina Heart Center. That's right. And I want to thank him. And he's right on Cook Road, right here in Orangeburg. And for those of you who don't know, he's my doctor. I'm very happy to say that I'm still alive. Thank you, Jesus. And I also thank you, Dr. Castro.
Thank you very much. My pleasure. All right, guys.